You know, it's still early summer, but parents across the country are already looking ahead to September and wondering, when can our kids go back to school? They've largely been out of class since the pandemic struck in March, and now school boards are looking at options for a safe return. Ottawa's Chief Public Health Officer Vera Etches says the priority should be back to school 5 days a week. Alex Munter agrees with her. He's the president and CEO of the Children's Hospital of Eastern Ontario, right here in Ottawa. Alex Munter, thank you so much for joining me.
Good afternoon.
So you say governments need to prioritize 5 days a week school and childcare. Why take that stance when we're not quite through it yet?
Well, it's a subset of a bigger issue, I think, which is that one of the untold stories of the pandemic has been that children have really been dramatically affected by the measures that we had to take to respond to COVID. And so children have lost childcare, school, friends, relatives, grandma, kids with special needs have lost access to the supports that they need. And so as we think now about the recovery plan, we really do need governments at all levels to put children front and center in those recovery plans. And that includes then the issue of schools.
I've got a 6-year-old in the school system, and the communication that I've been getting is essentially the hybrid model. Seems like the most likely model where students either alternate days or weeks in the classroom. Do you consider that one a viable option?
Well, certainly in talking to infection control experts, they are concerned about that because we're probably better off putting kids in a bit of a bubble, a school bubble. If we have them for 5 days with the same kids in a supervised and regulated environment, that's probably better than having them on alternate days sprinkled across large numbers of caregivers and friends and really having much more contact with many more people. But here's the thing about COVID in schools that we can see from other jurisdictions in the world. It's not that COVID will spread in schools and then into the community. It's the other way around. Mm-hmm. That if there's a lot of COVID, if COVID is rampant in the community, it will come into the schools and then spread there. And so the other part of this, if we really want to get to that 5 day a week school week, the other thing is we need to prioritize opening schools above everything else. We need to put kids first. And so we need to say, why are we talking about opening bars and gyms and bowling alleys and whatever else when we don't have the schools open yet? Because we need to contain we need to contain COVID in the community. We need to keep rates of transmission very low. We need to have the capacity to test, trace, and isolate when there are flare-ups in order that our kids can go back to school. And that, I think, is the issue. Here in Ottawa, 2/3 of parents in a poll done by Ottawa Public Health, 2/3 of parents are concerned about the emotional well-being, mental health, and developmental well-being of their children, and half of parents are struggling themselves. And so we need to make it our number one priority to be able to get kids back in school. And so part of that is about what happens in the schools, but really most of it is about what happens outside of schools, and that falls on grown-ups. That falls on all the rest of us. Kids, the vast majority of kids live in families, and so when there's pressure on the family, whether that's economic pressure or also the pressure of isolation, that too plays itself out in these kind of impacts. And so that's why, in our world, in the child and youth health world, our appeal to the broader community is we need to put kids first, and that means we all need to stick with these measures. We need to wear a mask. We need to keep indoor environments that are prone to spread of COVID closed in order that we can get kids back to school, in order that we can support their development and their emotional well-being and their education. And then once we've got that down and we know it's working, then we can go to the broader reopening.
There is some growing evidence or consensus, at least, that schools are low risk, but not necessarily no risk. So how do schools sort of balance the mental health benefits and emotional health benefits of a return to class with the risk of spreading the virus? Because while the kids may not be super vulnerable, there's teachers, there's janitors, there's administrators, and they could fall into the high-risk groups.
Absolutely. And we have to protect the health of staff in schools. That has to be a top priority. And so, there will need to be the kinds of accommodations that are happening, everywhere, in retail and hospitals and in factories, in terms of separation, in terms of PPE, in terms of cleaning and infection prevention. All of that needs to happen for sure. But the thing that will make schools the safest of all is when there isn't COVID in a significant amount in the community. And so the fact that we can even have this conversation is because we have really, as a community, as a country, we really were able to flatten the curve. We would not be able to have this conversation if we were in Texas right now. And so, I guess from the perspective of people who care about child health and people who care about kids, which I think is almost everybody, put your money where your mouth is. Let's put the reopening of schools and daycares first, make it our top priority, and then really test every government decision against whether or not it will bring us closer or move us further away from that objective.
Okay. Alex Munter, thank you so much for your time.
Thank you.
That is Alex Munter, the president and CEO of the Children's Hospital of Eastern Ontario, right here in Ottawa.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.